All right, I just got consent from a patient and I figured I'm not a big fan of doing this because they're in such severe state of pain that I don't like to ask for recording permission, but she was generous enough to let us actually record her treatment for today. So we have a patient in a severe state. This is treatment number 4. We sent for MRIs, which I'm waiting on results. We are suspecting compression of the cervical cord causing muscle atrophy. Okay, so we're gonna first decompress her lumbar spine and then decompress her cervical. Giulietta Mora Carelia. Okay, okay. Tourniquet lembere. Okay. Patient couldn't take one step without her walker on the first visit. We were able to get her walking to celebrate her birthday. This is amazing. Okay. So card nas to make. Okay. Okay. Yeah, it's okay. It's este. Uh-huh. Okay. Okay. I'll secure votere. Okay. Okay. Jacket nereden renk? Okay. Okay. Hangi stack? Okay. Make. Okay. We're treating her manually with the Cox table, Hangi stick. Okay. Always want to make sure patient's comfortable. All right. Tutu. I'm actually going to reset her SI joints prior to decompression. Miki Jarach Karank. Okay, lava. Okay. And just very gentle with very little resistance, okay? Because I don't want to thrust too much and cause her to flare up. She's in a very sensitive state. But the fact that you just witnessed her walking here without assistance of a walker or me or one of her children is a big step as far as progress, okay? Hangi stick? Okay, perfect. Her lumbar is improving a lot faster than the cervical. Okay, Schunschners. Out. Again, this is not about speed or whatnot. The important thing is there's signs of improvement. Her symptoms are improving, which also gives her hope, which is very, very crucial. And the patient is very understanding and committed because she knows that these symptoms and injuries didn't happen overnight. So she understands that her pain isn't going to go away overnight either. So as much as I treat her, she has restrictions that she follows at home. And even last week, I had her son purchase something for her to take care of her neck at home, which I'm going to actually talk to him about afterwards. Something to help treat her pain or like a good alternative, at least to till she comes back in for her next visit. Okay. If patients have diabetes, for example, those patients may take longer to heal because diabetes can slow down the repair process. Hangi stick? Okay. Shunshner's. Okay, give a few axials like this just to stretch the soft tissue before stopping it at my wanted distance. Shunshner's. Breathe in, out. There we go. Something just popped. Զգացիք Julieta Zgatsik, չէ, անցվել անգամ էլ. So it's very common, especially with severe disc injuries, when decompressing to hear an audible, a pop, okay? It could either be the facet joint popping back into place. It could mean the disc fluid has filled into the disc or nucleus pulposus, causing it to shift and mobilize. Although that may cause pain locally in that segment for a day or two, that is actually a very good thing to happen. That means it is going towards improvement. Good. When patients say, I have high tolerance to pain, that's one of the things we don't like as doctors, because by the time their pain is at a level where they actually go see a doctor, it's already chronic or gonna take a lot of time, and or patient is left with very minimal options. Okay. For her, I go from the base up instead of just measuring from the iliac crest to find L4. It's just to make sure I don't miss L5 SP. Shunshner's. Durs. Good. She's breathing a lot better, slower, which means she's breathing more comfortable and in not as much pain. When someone's in a lot of pain, it's more common for quick, shallow breaths. Okay. Okay. On your stick? Okay. Okay. Meshki v'ra. With her, also, it's not that simple to take her from room to treatment table to treatment table. So we're trying to make it as convenient to her as possible. Օգնեմ, պիտի մեջքի վրա պարկեք։ Ոնց հանենք, որ հարմար է ձեզի։ Okay. First visit took a bit of time to get her to move, so you could see why we don't want her moving too much. Okay. Voted. Լույսերը մի քիչ իջեցնեմ, հանգիստ աչքերը։ Okay. Ուրակ ջան, մի քիչ։ Ելնեմ։ Չէ, շատ լավ եք, Okay. Okay. I'm just gonna go get we have dimmers, so when a patient is face up, they're not in discomfort when they're face up. Okay. Hangistec. Okay. So I'm not going to stretch for too long, because after this, we do put her on the hill decompression table for 15 minutes. Okay. So, Shunshner's, Durs. Durs. Hangistec. Ասեք։ Ուզում ես փագեմ ականջդ կամ տակից է թամ, ոնց է հանգիստ ձեզի։ Okay. Այդ հենց դուք շնչեք ներս ու դուրս։ Okay. Okay. Հա։ Շնչեք։ Դուրս։ Good. Դուրս։ Շատ լավ, դուրս։ Խորը շունչ ներս։ Դուրս։ Good. Hangist. Այո. Good. It's where the eyes open up. Hangistec. Okay. So instead of having her get up and get into a seated position, I just adjust her cervical supine, and we avoid as much rotation as possible. Okay. you chiros out there, the headpiece doesn't go up in flexion that much. So make sure to put her in flexion before delivering your thrust, okay? Never adjust an extension. Okay, good. Let it settle in. Like, okay, good. Okay. Piti oknek patrastek helnelu. Ah, patrastek. Okay. İçilsin. Good. Okay. Before կարած ձեռները տեսնես կողքի դնես, որ տենան. I'm not sure if you viewers could see this, but one of her hand sizes appears to be smaller. Okay. Chache, hangis descends mouth. So there is muscle atrophy, so the nerve is dying. So we gotta decompress, treat her as often as possible, and then once we get the MRI results, I'm gonna have to do my due diligence and refer to the most appropriate specialist to see what other options and practical options we have for her. Okay, so this one definitely decreased in size compared to the right. Use this to so the skin doesn't touch the strap. So obviously we asked patient how they felt, what they experienced, and I'm comfortable enough to increase it by 1 pound, okay? So we're gonna go 15 minutes. 15 minutes, okay. Shoot. Yeah, okay. So patient's asking for this, which I recommended for her. Anyone with a disc injury, I recommend laying on your back on a firm surface like this. This actually opens up the discs. So if the disc is curved like that, by flexing, you're opening up the back of it and causing some relief, which the disc injury itself is usually in the posterior, in the back. Okay. Okay, so now it preloads, gets a nice pressure, and these are all sensors, so it could feel if it's too much resistance and whatnot. So if it is, it will stop to prevent injury of the patient. Okay, patrastek. Okay. Once we finalize the room for this, we're gonna have either a projection screen for watching movies or whatnot, or just turn it off where you could see galaxies, so it's completely zen and relaxed, so you're not using your phone or whatnot. Okay, so I want complete relaxation here. So, okay, I sense lava. Okay, perfect. So let's set the timer for 4 minutes, and then we're gonna come check up on her. Perfect. So afterwards is just finish off the treatment with some ice, okay, just to cool everything down, and it gives you a better chance of not being sore at the end of the day or tomorrow. So I've experienced it. I actually enjoy the ice at the end. It just gives me time to kind of relax and just let everything settle in. So we put this right where she is at the end of the distraction, and after this, she's good to go, take on the day. Okay. Okay. Sure. Thank you. I'll see you next week, Wednesday, for acupuncture, and then we're gonna do decompression and stuff. And I'm gonna give her a breakdown of what to focus on. Okay, so we're gonna have Dr. Hart treat her with some acupuncture care prior to getting decompression therapy with me. So we're trying to take advantage of both professions here, which I know is gonna help speed up the process to get her to wellness. Okay.